In today's world, sexually transmitted infections, commonly known as STIs, are discussed more openly than ever before. Names like HIV, gonorrhea, syphilis, chlamydia, and herpes are familiar to most people. However, there are lesser-known infections that can also affect the genital region and sexual health, but remain largely misunderstood or ignored. One such condition is E. coli genital infection, a rare but medically significant infection that can sometimes be associated with sexual activity. This video is created to provide clear, factual, and responsible information about E. coli genital infection, its history, how it spreads, who is at risk, how it can be prevented, and why awareness is essential. While E. coli is not traditionally classified as a classic sexually transmitted disease, sexual behavior can play a role in its transmission, especially in genital and urinary tract infections. This video is especially important for people who want to understand hidden risks in sexual health, recognize early symptoms, and protect themselves and their partners. Knowledge saves lives, prevents complications, and removes unnecessary fear and stigma. Before we begin, please remember, this content is for educational purposes only and does not replace professional medical advice. If you suspect an infection, always consult a qualified healthcare provider. And if you value honest, research-based health education, don't forget to subscribe to WUTNews, where we bring you global awareness on health, science, and critical social issues. What is E. coli? A basic understanding. Escherichia coli, commonly known as E. coli, is a type of bacteria that naturally lives in the intestines of humans and animals. In fact, most strains of E. coli are harmless and play an important role in digestion and gut health. However, certain strains of E. coli can become pathogenic, meaning they can cause disease when they move outside their normal environment or enter vulnerable areas of the body. E. coli is most commonly associated with food poisoning, diarrheal illness, urinary tract infections, UTIs, bloodstream infections. In rare cases, E. coli can infect the genital area, especially when hygiene is poor or when certain sexual practices allow the bacteria to spread from the gastrointestinal tract to the genitals. Is E. coli a sexually transmitted infection? This is an important and often misunderstood question. E. coli is not a classic STI like HIV or syphilis. However, E. coli genital infections can be sexually associated, meaning sexual activity can facilitate the transfer of bacteria to the genital region. For this reason, medical professionals sometimes describe it as a sexually associated infection rather than a traditional STI. Sexual activities that may increase the risk include oral anal contact, anal intercourse without protection, poor genital hygiene before or after sex, sexual activity immediately after bowel movements without cleaning, improper use of sex toys. History of E. coli and human disease. E. coli was first discovered in 1885 by German pediatrician Theodor Escherichia, after whom the bacterium is named. For decades, E. coli was understood mainly as a gut bacterium. It wasn't until the 20th century that scientists realized different strains exist. Some strains are harmless. Others can cause severe disease. As sexual health research expanded, doctors began noticing recurrent genital and urinary infections linked to E. coli, particularly in women. Over time, research showed that sexual behavior and hygiene practices could contribute to these infections. How E. coli genital infection occurs. Primary transmission pathways. E. coli genital infection usually occurs when bacteria from the intestinal tract are transferred to the genital or urinary system. Common pathways include sexual contact, anal to genital contact, oral anal genital contact sequences, unprotected anal sex followed by vaginal sex, poor hygiene, not washing hands or genitals after bowel movements, incorrect wiping technique, back to front, sex toys, using uncleaned or shared sex toys, moving toys from anal to vaginal use without cleaning, medical factors, catheter use, weakened immune system, diabetes or chronic illness. Who is most at risk? While anyone can be affected, certain groups are at higher risk. Sexually active adults, women due to anatomical factors, men who have sex with men, MSM, people with poor access to hygiene facilities, individuals with compromised immune systems, those with recurrent urinary tract infections. Symptoms of E. coli genital infection. Symptoms can vary depending on the affected area and severity of infection. Common symptoms in women: burning sensation during urination, abnormal vaginal discharge, pelvic pain, genital irritation or itching, recurrent UTIs. Common symptoms in men: urethral discomfort, painful urination, penile discharge, rare, testicular discomfort, rectal symptoms, if involved, rectal pain, discharge, bleeding, tenesmus, feeling of incomplete bowel movement. Some people may be asymptomatic, meaning they carry the bacteria without noticeable symptoms. Diagnosis and medical testing.
Doctors diagnose E. coli genital infections using urine culture tests, vaginal or urethral swabs, stool cultures, in some cases, antibiotic sensitivity testing. Correct diagnosis is crucial because antibiotic resistance is an increasing global concern with E. coli. Treatment options. Treatment usually involves targeted antibiotics based on lab results, hydration, symptom management, avoiding sexual activity during treatment. Self-medication is dangerous and strongly discouraged. Global distribution and countries affected. E. coli infections occur worldwide, but genital and sexually associated cases are reported more frequently in United States, United Kingdom, Australia, Canada, Western Europe, parts of Asia. Higher reporting often reflects better surveillance, not necessarily higher infection rates. Prevention and protection methods. Preventing E. coli genital infection is largely about hygiene, awareness, and safe sexual practices. Key prevention strategies. Practice proper genital hygiene. Use condoms during anal and vaginal sex. Avoid anal to vaginal contact without cleaning. Clean sex toys thoroughly. Wash hands before and after sexual activity. Urinate after sex. Seek early medical care for symptoms. Long-term complications if untreated. If left untreated, E. coli genital infections can lead to chronic UTIs, pelvic inflammatory disease, PID, infertility, rare but possible, kidney infections, recurrent genital discomfort, social stigma and awareness. One major problem with rare genital infections is silence and stigma. People may feel embarrassed to seek help, allowing infections to worsen. Education saves health, relationships, and lives. Why awareness matters. Understanding rare infections like E. coli genital infection promotes safer sexual behavior, reduces unnecessary fear, encourages early diagnosis, prevents complications, improves public health outcomes. Final message to viewers. Sexual health is not about shame. It is about knowledge, responsibility, and respect for yourself and your partner. If this video helped you understand something new, share it with others. Awareness spreads protection. Important call to action. Shout out. Subscribe to WUTNews. If you want honest, research-based global health awareness, make sure to subscribe to WUTNews right now. Bell out. Turn on notifications so you never miss sexual health education, rare disease awareness, medical science explained, global health updates. Your support helps us continue delivering truthful and responsible information to the world.